going. Good morning, Ms. Jones. How are you today? We're going to be changing the dressing on your wound. I've already checked the patient's medical records and given any sort of pain intervention if needed. Now I would adjust the patient's bed if necessary. Make sure that the patient is comfortable. And then I will put on clean gloves. So I can remove the bandage without exposing anything other than the wound. I'll move the gown like this and use the push-pull method to remove the tape. And then dispose of this. I should have already placed this underneath here. And then I would check the wound to see if there's any necrosis, tunneling, check the drainage, any odor, the presence of it, the amount, type, and then I would measure it. So you go length, which is about 9 centimeters. Width is about 2, and then the depth of the wound, which is about 1. Dispose of that, and then I would begin to set up my sterile field. Performing hand hygiene after removing the bandage. So first I'll grab my drape, opening away from me. Making sure to only touch the 1-inch border. And then I would begin by pulling all these unopened packages 6 inches above the sterile field and dropping them. I'll place this underneath the wound to collect any drainage. And then my gauze sponges, I will, that didn't happen. I will dump one of them onto the sterile field and save the container on the side. And then the other one I will open and then leave the sponges inside and place on the side. I have already ripped my tape off here, and then I will dump the saline solution into both of these trays. If this wasn't a brand new bottle and unexpired, I would lip it first before pouring it in there. And then, now that I have everything onto my sterile field, I'll perform hand hygiene and put on sterile gloves. So opening the package carefully, I'll make sure the arrow is facing down. And then I'll open it from the cuffs here, only touching the 1-inch border. Reaching across with my non-dominant hand to pick up the cuff. Making sure to not turn my back to my sterile field. Dispose of this. And now I will begin by redressing the wound. I'm going to organize my sterile field a little here. Okay. So first I will irrigate the wound by getting sterile solution out of the empty one over here without the gauze. And then I will begin to irrigate the wound from top to bottom, making sure that every spot is getting touched, using the syringe 1 inch from the wound. If necessary, go again so that any of the drainage or anything coming out of the wound, you continue to irrigate until it runs clear. And then put that in there. And then I will begin to pack the wound. So oh no, I should dry it first. Definitely gonna dry it first. So I'll pat around the wound, making sure to dry every spot. And then I will pack the wound. So I'll grab the pre-soaked gauze pads out of here. I should have switched hands there to do that because I used my sterile hand. So then I would do this and then move this over to this hand here without touching with my sterile hand. Get a Q-tip and then begin to pack the wound, making sure not to touch my other hand. We'll leave that. And then I will grab 2 more gauze pads to cover the wound. And then grab my abdominal pad, place that over. And then now I'm able to use both hands. I will tape the abdominal pad to the patient. If necessary, I would have used skin protectant or a topical cream inside. Dispose of this prior to putting the bandage on if they needed it. Once this is all taped up, I will put 1 piece with initials, date, and time right here on it. And then I would dispose of all of this and get rid of all this, and then I would remove my sterile gloves, perform hand hygiene, and then continue to check on the patient as necessary.